Hi, my name is Emily Zeigenfuse. I'm a senior specialist in corporate communications at the American College of Cardiology. American College of Cardiology is a 39,000-member cardiovascular professional association. So what I want to talk about today is our new private social network that we launched on our website. So to give you a little background, when we launched our private social network, we launched June 14th, and when we launched, we also launched a brand new website. And what this website did was combine our old website, acc.org, blue-sided background, with cardiosource.com. acc.org featured corporate content, while cardiosource.com featured the clinical stuff. What we combined, we came up with this, cardiosource.org. And the part that we're going to talk about today is Cardiosource Communities, our private network. So what that allows you to do is you can comment on content around the site, mostly the clinical content, but also the products. You can have a profile with a blog. You can join groups, and you can participate in forums. So basically, your basic social network functions. So what were our expectations going into this? On cardiosource.com, we actually had very similar functionality to the comments. We knew that the comments would probably be popular. We were not sure, however, what was going to happen with the groups and what would happen with the forums. So what actually happened? What follows is a selection of comments that occurred in the first 3 days. Your new CardioSource is not working. I wasted my time and my money. The website is awful. I give up. I want my money back. Terrible. And this one is actually my personal favorite. Good thing the World Cup is on. So, faced with this outpouring of clear frustration as to what was going on with the new website, what on earth are we going to do? This is the moment we decided. Keep calm and carry on. So what did we start by doing? We looked through the comments that were coming and we're like, what is some of the common themes that people really hate about this site? Turns out they thought the site was slow. So what did we do? Our IT department, I think, worked till 1 a.m. the first night the site was live and figured out what was going on that was causing it to be so slow. They fixed it, things were fine the next day. Another problem were the products pages. Products pages, there were a couple of things that we knew were wrong with it or that weren't very user-friendly when we launched, but we were on a deadline and we had to get it up. So we automatically adjusted what we were doing on the site to make it a little bit more clear how you could access your products. So we put language on every product page saying, this is how you access your products. Very specific instructions. If you can't get it to work, call our resource center and we'll walk you through it. If not, send us an email. We put links to that language again on each home page. We put a direct link to the programs because that was another comment that we were getting. Commented on a lot of content, myself and so did my colleagues. It was a stressful couple of days. And then for the people who were really frustrated, and you could sense their frustration because it was the people who were commenting again and again, you saw them get angrier and angrier with each comment, we sent personal emails. Said, I saw your frustrated comments, and I have had IT personally look into your problem, and they assure me it's fixed. But if you have any questions, if you have any more problems, here's my name, here's my phone number, here's my email, here's my BlackBerry number. You can call me, you can reach me, I'm here to help you. That said, there were some things that were positive. We got useful feedback on some of our performance improvement tools. We got great suggestions of how we could promote heart-healthy behavior. We had discussions between our fellows who are MDs but not cardiologists yet, and training directors. And we got great group membership. So here are some of the things that we've learned. One, you have to be ready to respond quickly and publicly. I had made, prior to launch, a beautiful flow spreadsheet. And everything was color-coded, depending on the type of content, depending on what kind of response you gave. But we had 30 negative comments pour in 12 hours. The flow chart sort of went out the window. We just had to respond as quickly as possible. Again, you must be willing to make changes. We actually made several changes to the website based on people's feedback. One, we made it quicker. Two, people were having real problems with pop-up windows. So one of the things that we did is they couldn't get the pop-up blockers to work, or to get rid of the pop-up blockers. And in some cases, it was a matter of just turning it off. They didn't know how. In other cases, it was they were at an institution, they couldn't turn it off. So we have our products open a new window now, which helps with the problem. Comments. They might be negative, but they are there. And now that the negative comments have died down, and they died down significantly after the first week and a half, they're the most effective part of the community. You can see people having discussions between each other about the clinical content, about the content of the clinical trials, and whether they hope the trial is valuable. So this is by far the strongest portion of our community. Finally, groups can be effective with staff attention. So there's a difference between the groups that have very active staff liaisons who are in there creating connections between what happens in the group and what happens in the organization. And those are the groups that are the most vibrant versus the ones that don't get a lot of staff attention. They don't have a lot of members, they don't have a lot of discussions. Finally, forums. We are still struggling to get our forums to work, and this is one of the things that we're going to have to examine in the next 30 days is how we get people onto the forums, how we get them talking to each other. Do they need to be more visible? Do they need to have some sort of content stimulus that gets them talking? What is it that we can make better? That sounds good.